My name is Leslie Carr. I'm a registered clinical psychologist in private practice, and I'm here today to talk to you about therapy. I really love what I do for a living. It's truly what gets me out of bed in the morning, but I have a dilemma in my work, which is that from my vantage point, it seems that therapy isn't very well understood. Even though I think we've come a long way in this regard, there's still a fair amount of stigma that surrounds psychotherapy. And even more significantly, it seems to me that there are a lot of misconceptions about it, and that it's something that's generally mysterious to most people. It seems to me that these misconceptions keep many people from trying therapy, even if it would benefit them, which is a travesty to me. So I really see it as my mission to increase our collective understanding of what therapy is and how it works, so that we can start to change the way the world looks at it. Now, first of all, I should explain that the kind of therapy that I practice, and the kind that I'm going to talk to you about today, is the kind that's traditionally referred to as psychodynamic or psychoanalytic psychotherapy. I know that it can be confusing, because there are a lot of different kinds of therapy out there these days, but what I'm talking about is what I'll refer to as the old school kind of therapy. The classic kind, where you talk and another person listens and asks questions and reflects. It's sometimes called insight-oriented therapy, and I think that in many ways it's gotten a bad rap in recent years. One of the single biggest misconceptions about this kind of therapy is that there's no scientific evidence that it works, which is actually not true. Research in this field has demonstrated not only that it works, but that it works really well. So I'm going to dig into this a little bit. Now, my talk today is not going to be super data heavy, but the stuff is actually really interesting. So if you don't mind, I'm going to run some numbers by you. For those of you who speak research, and if you don't worry, I'll come back to you. A meta-analysis of 23 randomized control trials found an effect size of 0.97 for overall psychiatric improvement and 1.51 for follow-up studies conducted 9 months after the therapy ended. This study is one example of hundreds that have been conducted in this area. Now, for those of you who don't speak research, effect size is the statistical measurement of how much something works. An effect size of 0.2 is considered small, 0.5 is considered moderate, and a large effect size is 0.8 or above. So to give you a frame of reference, the effect size for Prozac, according to studies conducted by the FDA, is 0.26. I'll just let that sink in. Because these numbers, 0.97 for overall improvement and 1.51 at follow-up, are really off the charts, actually. It's pretty astounding. Part of what that also means is that people continue to benefit from therapy even after they stop going, which is pretty cool. Now, this kind of therapy helps people who are experiencing psychiatric symptoms or who are suffering in some way, of course. I do want to make that clear. But it also helps people in the name of personal growth, and it works according to the same principles. It helps us to gain insight into how we relate to people, to identify and change recurring patterns. It increases our consciousness and improves our decision-making. And we reap all these benefits, whether we have a mental illness or not. Excuse me. So let me tell you a little bit about me. I chose to become a therapist because I was once, many times in fact, a therapy patient myself. I was blessed to grow up in a family that valued therapy and that didn't buy into the stigma. So when we encountered challenges in my childhood, namely the potentially terminal illness of a family member, my parents did what they thought was best, and they sent me to see a therapist for the first time when I was 10 years old. I think they made that decision largely out of being proactive, but it was also really clear that I was struggling, and most of that was manifesting in my experiences at school. My grades were slipping, my teachers were reporting that I seemed distracted. The anxiety and sadness that I felt about what was going on at home was making it hard for me to pay attention, and I was falling behind my peers. Now, I have to tell you that I consider that, to this day, the decision that my parents made to send me to a therapist, as being one of the best things that's ever happened to me. I really do. Of course, I liked it so much that it made me want to become a therapist myself, so clearly I got a lot out of it. But I also have to admit that I really didn't want to go at first. It'd be hard to say what I was so afraid of exactly, because I was so young at the time, but I was terrified. And I literally, at first, refused to even go into the woman's office. We spent the first 2 or 3 sessions in the waiting room, and that was what therapy was for me at first, just trying to get comfortable enough to go into the woman's office. And the funny thing about that, for me, is that having had those early experiences really removed any sense of stigma from therapy, for me. But I also clearly would be lying through my teeth if I were to say that I don't know what it's like to be afraid at first to give it a try. Now, I know that it's different with adults from children. I mean, after all, I only work with adults, so my only point of reference for child therapy is my own. But I do think on a fundamental level, the feeling is the same. And I think it really just has to do with fear of the unknown. I just didn't know what that lady was going to do to me. I felt like she had some magical power, and I didn't know what it was, but I felt like she was going to get in my head or something, and it just kind of freaked me out. And it reminds me of how sometimes today, now that I am a therapist myself, I'll get this feedback from people sometimes that they think that I can read their minds or something. And it always makes me laugh a little bit, because that's not how it works. But I suppose on some level I can identify, because I have a vague recollection of having felt that way myself. I do think that for many people, there's a lot of fear of the unknown about therapy. We might consider giving it a try, but we avoid it just because we don't know what it's going to be like. I think there's also some fear and trepidation that comes up around sharing our thoughts and feelings and vulnerabilities with a stranger, and perhaps some concern that we're going to be judged for what we reveal. And I think that's a really natural concern, honestly. I think it's very common and very human. I personally don't think that there's any room for judgment in therapy, and I know that that's a sentiment that I share with many of my colleagues. But nonetheless, I always recommend that people treat first therapy sessions like interviews of sorts, because a lot of the fear that comes up around unloading to a stranger goes away once we establish a connection with a real flesh and blood human being. And this brings me to something really significant that I want to make sure that I impart to you today, which is how vitally important it is to really be discerning about the therapist that you choose to work with. This could be a whole separate talk in and of itself, but the single most important factor in any effective therapy has to do with the relationship that's built between therapist and patient or client. The relationship in therapy is actually what accounts for most of the change that occurs. It's a complex process. But studies show us again and again that it is the single most important ingredient in therapy, the relationship. So I really want to empower you to be discriminating. If you're wondering how to pick the right therapist, it's really just about trusting your gut, because the most important thing is that you find the person who's right for you. But if you've tried therapy in the past and you've had a bad experience, please know that it can be better the second time around if you find the right person. Now, I do have a reason why I think that we should all see a therapist at least once in our lives. And my hope is that hearing this will spark a little curiosity in you and perhaps help you to look at yourself and the world around you just a little bit differently. It certainly isn't the end-all, be-all to what people get out of therapy, but it's fascinating to me because it's something that applies to all of us. I think that most of us have a sense of appreciation for how our life experiences can impact our emotional lives, but I want to suggest a subtle shift here. That our life experiences shape not just our emotional lives, but our very understanding of what reality is. Different branches of psychology have different names for this: schemas, relational templates, scripts. But regardless of what we call it, what it means is that our early childhood experiences create our understanding of how the world works. In fact, all of our experiences throughout life do. These relational templates, as I'll call them, are always shifting at least slightly. But this is particularly salient when we're children, because when we're young, we don't have a sense of what's normal or abnormal. There's no objective standard that we can compare our lives to, and children's brains are like sponges. So every early experience that we have when we're children works to create this internal script of how we think the world works and how we expect people to respond to us. Now, part of why this happens, this might help in your understanding of what I'm talking about here, has to do with how we learn as humans. To use a very basic but kind of funny example, if every time you got behind the wheel of a car you had to learn how to drive all over again, it would be pretty hard to get by in the world, right? But no, you get behind the wheel, and you expect, assuming that the ignition is turned on and that the car is in gear, that if you put your foot on the gas pedal, the car will go forward or backward, depending on which way you're headed. But you make that assumption because your past experiences dictate your expectations of how the world will work in the future. The tricky part is what happens when we apply this theory of learning to our emotional lives or to human relationships. To give you an example that I think will resonate easily for everybody, if we take a child, let's call him Joe, and raise him in a combative, hostile environment, imagine that he's physically and emotionally abused, he's likely to grow up with an unconscious expectation that the world is a violent, angry place, and that he needs to be aggressive to get by in it. The problem here is that because Joe's expectations are that people aren't trustworthy, because the psychological world that he lives in is an aggressive one, he's probably going to operate in a manner that's generally combative. And you can bet that if his manner of being in the world is generally combative, that most people are going to treat him with a fair amount of hostility. And so it goes. Joe's unconscious expectations of how the world works have been confirmed. This is the essence of self-fulfilling prophecies. Now, the slightly dramatized example is probably easy to imagine for everybody, but what might be more surprising is that some version of this is also how all of us learn to function in the world. We all think that we see the world very clearly, despite the fact that we're looking at it through specific lenses, which have been created by all of the experiences that we've had in our lives to date. The unconscious beliefs and expectations that we have about life can be very subtle. They can be as relatively simple as not going after what we really want because we believe deep down that we're unworthy. And they can be as complex as staying in relationships with people who hurt us because that's what our understanding of love is. Put them all together and they create the very fabric of our individual universes. So to use an example that's probably closer to home here, our relational templates have a lot to do with the people that we attract into our lives, our romantic partners especially. If we have a hard time finding a partner, or if we feel incredibly frustrated with the one that we've got, at some point we have to recognize that we are the thing that all of our experiences have in common. And this is the reason why we can all benefit from therapy. It's also part of the reason why talking to a therapist is not just like talking to a friend. What a trained therapist does, among other things, is help us to explore the role that we're playing in our own lives. Because if you can't see the role that you're playing in the circumstances of your own life, you're powerless to change them. The beauty of this kind of therapy is that it carries with it a deep respect for the human condition. Because it isn't about sickness versus health. It's about expanding consciousness. It isn't a sign of weakness, but a sign of strength, because it takes courage to look at the parts of ourselves we'd rather avoid. For anyone who's experiencing psychiatric symptoms, this This therapy can help. I just want to repeat that. But the aims of psychoanalytic therapy don't stop there, because psychological health isn't defined by the absence of symptoms. It's defined by the presence of inner resources that help us to lead more fulfilling, satisfying lives. If you're struggling or suffering in some way, I hope I've said something today that will help you to feel less fearful of reaching out and getting the help that you need. But even if you aren't, it's time for us to change this conversation. We owe it to ourselves to explore our inner worlds and to take control of our destinies. And therapy helps us to do this. I believe this with every fiber of my being. And I believe that you're someone who's worth getting to know. Thank you.